Hi everyone, I'm Dr. John Kennedy. Welcome to MD-VOD, Your Health Live and On Demand, where each week we examine a medical challenge and help you better understand what the challenge is, who's at risk, the common symptoms, how to make a diagnosis, treatments and therapy available, and whether insurance covers the costs. Today, we're talking about sports-related injuries. Sports seem like a great way to burn calories and lose weight. And according to Sports Illustrated, almost 2/3 of all males play sports, and Women's Weekly tells us that nearly half of all females also participate in sports. In the United States, about 30 million children and teens participate in sports, leading to more than 3.5 million injuries each year. Obviously, some sports are more dangerous than others. For example, contact sports like football can result in a higher number of injuries than non-contact sports like swimming. Though all types of sports have the potential for injury, whether from the trauma of contact with other players or from the overuse or misuse of a body part. Later in the show, we'll be joined by sports medicine and rehab specialist, Dr. Ramin Hazany, who will help us better understand sports-related injuries. And today, we also have a special fitness and exercise segment with Kim Johnson from Dancing with the Stars. But first, let's take a look at the anatomy of the most common sports-related injuries. Welcome to our anatomy lesson on the most common sports-related injuries. The most frequent are strains and sprains of the ankles and knees. A sprain occurs when a ligament tears or overstretches, and a ligament is a band of connective tissue that attaches bones to other bones, which are in our knees, wrists, and ankles. When we twist the ankle, for example, we stretch the ligament known as the talofibular ligament, and from the front it looks like this. When we stretch this ligament, our foot swells, becomes painful, and discolored. So that's our anatomy lesson on sports-related injuries. Make sure to stick around because up next, we'll have Dr. Hazany answer your questions live. Hi everyone, welcome back to MD-VOD, where today we're talking about sports-related injuries, and we're joined by sports medicine and rehab specialist, Dr. Ramin Hazany. Dr. Hazany, thanks for joining us.
Thank you for inviting me.
Hey, so let's just get right into this. You know, what are the most common sports-related injuries?
Well, if you look at the statistics, the highest number of sport-related injuries that basically come to emergency room or requesting any kind of remedies or treatment are ankle sprain among the whole musculoskeletal type of injuries. But it really depends on type of sport that people do. We basically having it in two different categories. One categories are higher impact type of exercise program, like let's say people who are cycling or the one who are skiing. These people are getting involved with some sort of very serious injury like brain damage, concussion, those type of things. But the second part of this type of disease or injuries related to some sort of less serious type, like musculoskeletal and pain and this type of thing. But again, to answer your question, the most common type among all the injuries is basically ankle sprain that we see.
So who then is at risk?
Depends what individual you're dealing with and what type of mechanic of the body you're looking at.
So sorry to interrupt. So it might not be that older patients are getting.
Well, you can look at it from different point of view. Overall speaking, the most common type of injury happens in unprepared body. If you have an unprepared body, no matter you're young, old, it happens. So you have to be prepared.
So the weekend warrior that hasn't played basketball for 20 years, it's playing in their office, basketball tournament. That's when you're at risk, when you're not conditioned and you're not ready to.
You're sitting in your office, typing, writing, telephone, and then at the end of the month, your friends say, let's go play soccer or something. Then you come back with knee injury, ankle injury, foot pain, leg pain, back pain, neck pain. So it really depends the knowledge of you have from your body mechanics, body anatomy, and you are the best person who can decide what part of your body is having problem with, and try to focus on that part and prevent yourself from getting more and more injury.
So let's say a patient comes to you, they're playing in their office party basketball game, the annual basketball game, and they twist their ankle. How do you make a diagnosis, and how do you know it's a strain or sprain versus a fracture?
First of all, you sit and talk to the person. That's the main thing. You don't want to look at it and feel like you're Einstein and not making a diagnosis. You need to look at it and spend time, even if the problem is very small. Everything is important for the patient, so you have to look at it seriously. You examine the patient and take the good history. Depends on what kind of injury happens from functional standpoint. For example, if the guy says, okay, my ankle twisted to the right side or left side or inward or backward, that basically guide me to make my diagnosis, what part of the ankle basically damaged. Usually if there is a fracture, people have severe pain. So they are not going to be able to make it for a day or two to come to the doctor. They usually have severe pain. They cannot put weight on it. They usually ended up in emergency room. If they can't walk on it, pain is less, swelling is less, it usually comes from an ankle sprain or strain. There are one condition in between that basically people tear a ligament or tendon. That is something that basically you have to be aware, and sometimes even you need surgery for that. So a good examination, a good physical examination and history taking, and seeing that the ankle is swollen, is red, is tender, you put weight on it, is uncomfortable, you can't walk on it, this is something that you have to really seek medical attention and go to your doctor and ask what's going on.
That's a great point. So if you are out not preparing and go out and play a game of basketball when you haven't trained much and you twist your ankle, as Dr. Hazany points out, if it hurts so much that you can't walk on it, if it's severe pain, please go and get it checked out, because it's much more likely to be something more serious like a fracture or a break. You mentioned another common injury from repetitive injury, like carpal tunnel syndrome. Who's somebody who might be at risk for that common disease?
Those type of injury usually is not some sort of acute thing. I mean, people come, they say, okay, I play tennis or ping pong or something, and my wrist hurts at night, it goes numb, I have tingling to my hand. When I write something, it's uncomfortable. I wake up in the middle of the night, I have to shake my hand to prevent it from waking me up. So these are the things that caused because of repetitive trauma. You hit on your wrist for years and years, and that basically damaged the nervous system of the wrist area, which is the basic thing, is one of the most common nerve is median nerve that cause what you said, the carpal tunnel syndrome. In order to diagnose that, you need to do some sort of nerve test. It's called nerve conduction study, or EMG. That basically that test is almost 100% diagnostic. So when you do the test and you have your diagnosis, you know what it is and you go after it and treat it. There are some other treatments for that, like very conservative type of management, which is some sort of hand therapy that there are physical therapists that are specialists in hand. They do some treatment, or usage of different type of braces that basically you have the patient put it on, and actually I have some sample of it. This is very simple one that basically if you have carpal tunnel syndrome, it goes right on your wrist. The technique is just holding the wrist in one position and not preventing it from bending forward and backward. So that prevent the pressure and protect your wrist from all the micro trauma to the wrist area, and that basically prevents you from having more numbness, tingling. And
so just the immobilization of the wrist, not allowing it to flex or extend, can help heal? Is that right?
It doesn't heal, but it prevents you from your symptoms. This is not a treatment. This is a remedy. It gives you some relief. You do some hand therapy. If you really want to do a treatment, there are two options. One is some sort of injection with anti-inflammatory with cortisone, that we do the injection right at the wrist area. And the last type of management that we do basically is surgery. That's hand surgery, usually goes inside and open the nerve and release it, and basically patient gets some relief.
So that's a really good point that Dr. Hazany makes. Racket sports, ping pong, racquetball, tennis, the repetitive trauma can actually lead to carpal tunnel syndrome, which is a damage to the nerve that feeds our hand, and that repetitive trauma can cause that. What are some of the first medications that you might use before you get to injections and some of the wrist brace?
But basically, there are some anti-inflammatory medication that you can give to take care of the pain in the beginning. But there are some other medication that shows that it gives you some relief as well. A medication called Neurontin or gabapentin that basically calm down the nerves, and people have some good benefit of it. There are some studies that shows vitamin B6 helps, but that is not 100% approved. So you may want to take it. It may help, it may not. But there is no 100% statistical study that vitamin B6 then can help carpal tunnel syndrome. But the main treatment is basically doing those injections or going after surgery for your wrist.
And do the anti-inflammatory medications like Motrin, Celebrex, do those medications work at all for the inflammation and swelling?
If you look at the carpal tunnel syndrome, because the mechanic and the repetitive trauma is there, and you keep doing it, you're doing your sport, you damaging your wrist, just taking pain medication, no, that's not going to help. You have to take care of the main issue. You have to take the pressure off of your wrist. You have to rest and go through the hand therapy program until the pressure is completely taken off of that nerve, and nerve getting better after a while.
And you talked about sort of the last sort of ditch effort in carpal tunnel syndrome with surgery. What are some of the side effects or the complications of that type of approach?
Surgery doesn't have 100% results. The later you go for surgery, the less chance of improvement you have. If you have carpal tunnel syndrome for years, doing surgery may not relieve it 100%, and in fact, you may not get much relief. It gets better, but not really 100% better. There are some complications of having like tissue stricture around the nerve after surgery, and in fact, sometime after surgery, because of the scar tissue around the surgical area, sometimes the symptoms are getting worse. These are some sort of complication of it. That's why it's better to diagnose it early, treat it early with non-surgical. If it doesn't work after years, it's uncomfortable, you cannot sleep, you have pain, then you go see a surgeon.
And real quickly, let's say I have carpal tunnel syndrome, I'm having symptoms, I'm out playing tennis, and then I notice it gets worse at work when I'm typing and sending emails and so forth.
In fact, it's called typing syndrome.
Typing syndrome.
It's very common after computer came to the market, and we see tons of this type of problem. People are having doing typing all day long. They have this pain, numbness, tingling to their hand. What you want to do, as I said, it's basically a nerve test that basically diagnoses it. And unless you do that test, you just have to guess. Is it carpal tunnel? Is it some problem up here that radiates down to your hand? Is it problem up on your neck that comes down to your hand? You wouldn't know until you do the test.
And that's where you said the history is so important. How did you develop the symptoms and so forth? My final question is, let's say someone comes to you, they have symptoms that sound consistent with carpal tunnel syndrome. Does insurance cover the costs of, let's say, your consult and the EMG test that you talked about?
The consult, usually when they come to us, we see the patient. The problem is, as I said, the EMG and nerve conduction study the test that we need to do, we usually need to get approval from insurance company. Generally speaking, most of them they approve. If it comes from a specialist that knows what he's doing, they usually don't give hard time. And we get approval in almost all of our patients that we need to with adequate documentation.
So that's great, great advice. If you do have carpal tunnel syndrome, a consult with a sports medicine rehab specialist would be covered, and the test that's needed to make the diagnosis is also most of the time, as Dr. Hazany points out, covered as well. I want to thank Dr. Ramin Hazany for joining us and giving us an incredible review on sports medicine and injuries. Make sure to stay tuned, because up next on An Apple a Day, we'll learn ways to prevent sports injuries from ever happening. Welcome back to Apple a Day with common sense tips to help you prevent sports injuries. Education is one of the best methods of injury prevention. Make sure to learn about the most common injuries in your sport, and also make sure to train and condition to build muscle strength and endurance gradually over time. And be sure to warm up and cool down, and have a regimen that includes flexibility exercises and stretching. Also, make sure you use appropriate protective gear that fits properly. And always keep a first aid kit handy. And for more information, go to cdc.gov, because the more you know, the more successful you'll be in living with or preventing a sports-related injury. I hope our show on sports-related injuries helped you understand what they are, how to prevent them, and what to do if it happens to you. This program and other episodes you might have missed are now available on demand at emPOWERme.tv's website and the YouTube channel. And don't forget to like us on Facebook, follow us on Twitter, and share us with your friends and family. Also, subscribe to us on YouTube and sign up for the newsletter for updates on the show and the channel. And be sure to leave us your comments and questions so that we can better help you with your health. I'm Dr. John Kennedy, and you're watching MD-VOD, your health live and on demand, here on emPOWERme.tv. We'll see you next time. And now, for any episodes you might have missed, they're available at the emPOWERme.tv website and the YouTube channel. And be sure to leave us any comments and questions so that we can better help you deal with your disease. We'll see you next time on MD-VOD.